Now we're going to go into Chapter 1 for the $1 Million Practice Formula. Why most podiatrists never reach $1 million in personal production. Hi, it's Don here. A few years ago, I was looking at my production numbers, and something didn't make sense to me. I was working hard, my schedule was full, I was seeing about the same number of patients as my partners, but when we compared numbers, some doctors were producing almost twice as much per visit. And that bothered me. Not because I wanted to compete with them, but because I realized something important. Most podiatrists think income comes from working harder, seeing more patients, adding more clinic hours. But the truth is something very different. Some systems, not effort, mostly determine income in private practice. And once I started studying those systems, everything changed. If you walk into most podiatry offices, you'll see the same thing. A busy schedule, patients in every room, a doctor moving quickly between exams. On the surface, it looks like a successful practice. But when you look at the numbers, many of these practices produce somewhere between $500,000 to $700,000 per year per doctor, and they stay there for years, not because the doctor isn't working hard. In fact, it's the opposite usually true. They're working incredibly hard. The problem is they're solving the wrong problem. My first mistake. For years, I believed the solution to practice growth was simple: more patients. If I could just increase patient volume, the practice would grow. So I focused on marketing, I gave talks, I worked on referrals, I tried to attract more patients, and it worked. My schedule was filled. But my production barely increased. Eventually, I realized something important. Once your schedule reaches about 22 to 24 patients a day, you hit a ceiling. You can't physically see more patients without sacrificing the quality of care. That's when I learned the most important equation in private practice. It's called the $1 Million Production Formula. Only three numbers determine your production: your patient visits per day, the days you work per year, and the average visit value. Most podiatrists focus only on one of these numbers, the patients per day. But the real leverage comes from the third number, the average visit value, or the per patient value. Let me give you an example. A typical podiatry practice, you might see 22 patients a day. You work 220 days a year, and the average visit is $120. That way, your annual production is going to be $580,800. Now imagine the doctor improves treatment planning and increases the visit value from 120 per visit to 180. Your production becomes $871,200 per year, without any extra patients, without any extra hours, just better treatment design. And then if you go from 160 to 200, that production value goes to right underneath the $1 million mark. The realization that changed my practice. When I first saw the math, it completely changed how I looked at patient visits. Instead of asking, how can I see more patients, I started asking, how can I design better treatment plans? When patients receive better treatment plans, something powerful happens. They get better results, and the practice grows naturally. So I have a few action steps for you. I want you to calculate your current visit value. I remember recently we were using ChatGPT, so I took the numbers from the year and I asked ChatGPT to calculate my per visit value. It was pretty easy. You take the total number of visits that you have in a year, and you have the total amount of production, and you can get your current visit value. Track your production formula. Okay, what is your current production formula for each month? How much are you producing per visit? How many visits are you seeing per day? And how many days are you working per month or per year? And that you can track your production formula. And then ask yourself one important question. Am I trying to see more patients or designing better treatment plans? That question alone may change the trajectory of your practice. So in the next chapter, we're going to look at the most important habit of $1 million podiatrists, tracking the right numbers. So I hope you guys found this beneficial. This was a real eye-opener to me in my practice and finding out, well, if I can just tweak this number, let's say $60 for one patient, another $100 for another patient, and always focusing on the per visit value and really giving quality comprehensive care instead of always being in a rush, I would be able to produce much more with my patients, and it wouldn't have to work as much. Now, this takes practice because many times, even I had a patient today, they get used to how you used to treat them. So if patients are used to you only trimming nails and doing calluses and seeing routine care or only doing cortisone injections, they're going to want that type of treatment. This patient I saw today, about 4 years ago, came in for plantar fasciitis, and they just wanted the cortisone injection because they said that's what I got last time. Or I had another patient that came in, and they had only 3 sessions of shockwave, and I currently do 6. So they always want what they received previously. So in order to change this, you have to be confident enough in changing your protocol of how to treat patients and have an explanation of why you're doing it differently. Otherwise, they're going to always want kind of the easiest way that they're used to having treatment. So if you guys found this beneficial and you want the whole book, you can go to podiatrypracticemastery.com/book, and you can download the whole PDF to read the whole thing. Otherwise, you can continue listening to this next podcast.